During these upcoming winter months, we are more susceptible to illness, but there are precautions we can take to keep ourselves and our families healthy. Dr. John Christ is a provider at Bronson Primary Care Partners in Kalamazoo and Three Rivers, and as a family medicine provider, he provides routine health care for patients of all ages with a special interest in orthopedics. And Dr. Christ joins us for our Bronson Health Chat segment this morning on WKZO. How are you this morning?
Doing well there, Ken. Thanks for having me. Happy to be here.
All right. Thanks so much for your time this morning. Well, the cold weather is here. The snow will be returning soon. How do we keep ourselves and our kids healthy through this upcoming winter season?
So, keeping our families and our kids safe throughout the winter months is important because, as we know, the respiratory illnesses, the viruses, tend to thrive in the wintertime. So, firstly, as we've heard a lot over the last few years with the COVID-19 pandemic, getting vaccinated is helpful against influenza and against COVID. Those vaccines are safe and have been proven to help avoid some of these respiratory illnesses, reduce risk of hospitalization, and reduce risk of severe symptoms. So getting vaccinated is still important against both the seasonal flu and the latest COVID vaccine. Next, another thing we heard a lot over the last few years, making sure we use good hand hygiene, washing our hands frequently, is very important. Most of these viruses that spread in the wintertime are spread via either droplet or contact. So making sure our hands are clean, as it's difficult to avoid touching your face or your eyes or your mouth all the time. If the hands are clean, it helps reduce the risk of transmission of viruses. Another thing to help reduce the spread is staying home, of course, if you're not feeling well. And that's not just if you have COVID or the flu. If you're really feeling unwell, staying home is a good idea. And then, of course, the other things that we suggest year-round, but are very important even in the wintertime, and oftentimes folks do these things less in the wintertime. Things like exercise can help keep us healthy and safe and happy and boost our immune systems. And then, of course, getting enough sleep is very important as well to stay healthy.
Doctor, what are some of the more common illnesses you see in patients who come to you during the winter months?
So it's very, very common to see all sorts of upper respiratory illnesses. So these are, what have been described as the quote unquote common cold. Oftentimes we don't identify exactly which virus it is if it's not influenza or COVID, but there are a wide variety of viruses, including RSV, which we've heard a lot about this year, that cause coughing, congestion, sometimes some like wheezing or shortness of breath symptoms. These are the most common types of symptoms we see in the clinics over the winter months.
Well, you've got the flu and you've got the RSV and COVID is still around. How do you tell the difference if you're in your home and somebody's not feeling well? Is it just best to not take a chance and to see a physician?
Yeah, at any point it's reasonable to see a physician. It's hard to tell based on symptoms alone. They all cause occasionally fevers. They all cause cough, congestion, runny nose, these sorts of symptoms. Certainly, full body aches and high fevers are more likely to be influenza or COVID than, say, RSV or rhinovirus or the other generally more mild viruses. But at any point, taking a home COVID test is reasonable. Calling your physician to get an appointment is reasonable, especially if you're having symptoms on the more severe side, like high fevers, chest pressure, or shortness of breath.
Dr. John Christ from Bronson Primary Care Partners in Kalamazoo and Three Rivers with us on our Bronson Health Chat this morning on WKZO. You no doubt see some severe health issues that you don't really see elsewhere in the year, like frostbite or hypothermia. How common are these?
Those are relatively uncommon in the primary care world. I have yet to see either of those come through the office since I started working with Bronson Primary Care Partners, but certainly are possible this time of year, especially as we get into January and February and the potential sub-zero temperatures.
Well, this is good information that you've shared with us as we head into the winter months. So where can people learn more?
So if you would like to schedule an appointment with me or with any Bronson primary care provider, you can call us at 269-286-7150 to get an appointment. We have a variety of locations across multiple counties in southwest Michigan. We have practices in Calhoun, Kalamazoo, and Van Buren counties. Another number you can call the Bronson Care Advisors at 269-341-7788. They can help you choose the right doctor based on your insurance, your location, your needs, and personal preferences.
Dr. John Christ, a provider at Bronson Primary Care Partners in Kalamazoo and Three Rivers, has been our guest on our Bronson Health Chat segment for this morning on WKZO. Doctor, thank you so much for your time and information.
Absolutely. Thank you for having me.